Hello, I'm Dr. Steve Hicks. We have Cedar Crest Equine Clinic in Palestine, Texas. This video is going to demonstrate the efficacy of using the Dr. Hicks's modified clog. Now I'm calling it Dr. Hicks's modified clog because we are modifying the wooden shoe or the wooden clog that was invented and is used by Dr. Michael Stewart. The wooden shoe or the wooden clog is a single piece of wood, flat, that is slanted on all three sides. And this does function well. I feel like that the improvements that we have made does enhance the use of that in treating laminitis and chronic fouling. Now the modifications that we have made include a pad to the back part. You can see it's set into the wood. There is a wooden toe piece with the slanted breakover. The pad extends to the outside medially and laterally, which gives greater support back here. It also helps to cushion the turn. Of course, the deep slanting breakover helps to alleviate the pull on the coffin bone when the horse walks forward. The other thing that we have modified is we have grooved around the edge of where the coffin bone will lay, helping to prevent the crushing of these blood vessels underneath and around the edge of the coffin bone when the deep flexor tendon pulls down. Another modification has been this thick leather rim pad. This also helps to keep the foot off of the wooden part to make sure that we get no pressure on the sole, crushing the blood vessels in the sole when the horse steps down on it. All of this is designed to allow the horse to elevate the heel, to relax the tension on the deep flexor tendon, and to relax or relieve the pressure on the coffin bone by the deep flexor tendon as the horse walks forward or when it turns medially and laterally. The following videos show typical cases of acute and chronic laminitis that we have seen here at the clinic. The videos are going to show the horse walking before we put the modified clogs on the feet. Then it's going to show them walking afterwards. Now these videos of these horses have no medication in them. We prefer not even using sedatives because we want to see how they walk after we put the modified clogs on them. They've not been blocked. They are on no pain medication. And so you can see the difference in walking before and after the clogs were put on. Some of the videos show them immediately afterwards. Some of them show them within 45 minutes. Some of them show them within 2 or 3 hours after putting the clogs on. Just walk her out on the grass. Okay. Now then, if you'll just walk her across. All right, that's good. All right, here's the mare walking about 20 minutes after applying the shoes and adjusting the shoes and putting the cushion material in the sulci of the frog. Notice how she's turning and stretching out a normal to near normal stride in front, even across the asphalt. This is the mare in the paddock 2 hours after putting the clogs on. we're going to watch to see how she walks on the gravel. If you remember last time, we had to pull her to make her walk. All right, notice I'm not even pulling. See how she crosses over when she turns? This is just showing one more time how they immediately lean their foot forward to relieve the tension of that deep flexor. You can see the slantedness, and you can see what I was talking about. That front part of the pad will crush down and be even with that wooden part, and you can rasp that wooden part back to move the breakover as far as you want to. Okay, that's good. Straight ahead, yep. Walk him on out the gate. All right, now we're seeing this horse that we've had the clogs on about, 10 minutes. Okay, turn him, Billy. All right, here we see the horse walking on a hard surface. Okay, turn him, Billy, and bring him back. You can see the horse is a lot more comfortable. And I'm watching to see if he's hitting flat or if he's hitting his heel first versus toe. And he's hitting just like we want him to, so we've got him in a good position. This is that same horse. How long's it been, Billy? 45 minutes? Yeah. About 45 minutes after getting the clogs on. You can see that he's much improved. X-ray we received in August or September of 2013. This is the left front foot. Now we're going to see the right front foot. This is the starting point for all of us with a chronic founder. So what are we trying to accomplish with this foot? As you can see here on the left front, we have improper alignment and deficient sole growth and size in this foot. We want to increase the amount of sole in this foot, and we want to improve the alignment of P1, P2, and P3. That is the goal, the ultimate goal of using the Hicks modified clogs over a period of 2 to 3 months. This is our end goal. You can see and this is the same foot, the same left front foot of that horse we just viewed. You can see the sole depth increase, and you can see the proper alignment of P1, P2, and P3. This mare has been walking normally ever since we put the clogs on. This x-ray was taken in March of 2014. And here we see the right front foot. You can see the development of the sole in this foot and the realignment and proper alignment of P1, P2, and P3. This is the goal. This is what we're trying to do with time used with the modified clogs, and this will occur over a period of 2 to 3 months or 4 months with usage of the clogs. Just wanted to show the growth rings on this mare's feet that have had these clogs on for going on 3 months now. You can see the evenness, and more so on the lateral side than looking on the inside on that right one. On the lateral, on the medial side of both of these, it's a little bit less even, of course, indicating that we've got more pressure on the insides, which we all knew. But you can see the even growth from after having the clogs on for about 2 to 3 months. Faster. Well, like this mare's walking, to watching this pink mare walking painfully, to this, both of these mares running in the pasture. Hello, I'm Dr. Steve Hicks, and we have Cedar Crest Equine Clinic and Podiatry Center in Palestine, Texas. Today I'm going to demonstrate how we put the Hicks modified clog on the horse's foot for our laminitis cases. First of all, we're going to discuss the materials needed. Initially, a 1/8 inch drill, just a small drill that is about the same size as a horseshoe nail, a little bit smaller. We will use drywall screws, 1 1/4 to 1/2 inch long. Here again, about the same size as a horseshoe nail. Therefore, it's not going to cause any more trauma to the hoof wall in putting the screws in as it would to nail a shoe onto the foot. The padding material, 2 kinds that I like to use. This is a composite put out by Equicast, and you mix it. It cures in about 5 minutes after you pack it into the sulci of the frog and across the heels. And it cures to about a consistency that you would find in tennis shoes. So it's not hard, but it's not real soft. One of the packing material that I like to use in some cases is this pine tar packing material. In those cases where we have we need some medication, moisture resistance to the frog area. It helps if you have battery powered tools with the bit for screwing the screws on one and the drill in the other. It improves the efficiency and the quickness with which you can get the shoe applied to the foot. Stop. Okay, we've got all of our materials next to us where it's handy. We've got the rasp, and I like to use primarily the rasp. Depends on how long the toe is and how much foot you have to take off. But I start with cleaning out the foot, cleaning the frog, and balancing the foot. And this area right here, I'll take and notch out just a little bit after we get it level. So when we put the packing in here, when the horse puts the foot down, the packing can make an exit out the back if need be. So we're going to level the foot, bring the hoof wall back to the widest part of the frog. I try to do all of this without sedation if possible, because I want to see how the horse walks after we get through. Now then, we've got the foot fairly what looks like level. We're going to check it with the shoe and see what it looks like. Okay, you see how that fits nice and snugly with the leather pad, just like you would fit a shoe. Now, we're going to, that pad in that wooden part is going to be right at the frog area, no further back than our hoof wall, right there. So we've got it like we want it, it's snug. Now we're going to drill our holes, pack it, and put the shoe over. We're going to drill 3 or 4 holes in the white line or in the hoof wall. We got 4 about an inch apart. We're going to come on this side. That one I put in the hoof wall. I'm just going down, and I don't put them any further back than right just a little bit past midway of the hoof, just like you're doing with putting a shoe on. I'm just going to put 2 on each side. Put our clog on. And we'll pack the foot, the frog I should say, then attach our shoe. It won't take much of this, but you need to use separate hands, because this hand reaching in here, when it comes into contact with that blue, it will start to harden inside there where that white part of the composite attaches or touches the blue part, or vice versa. So we're just mixing it up, about equal parts of the blue and the white. And like I say, it'll take about 5 minutes to cure. So we're going to pack the frog, apply the shoe. And we've got way too much, so I'm going to push some of it out. We'll squeeze it out. But you know, that's why we put those little niche things in between the wall and the frog. Now then, clog on the foot, and it's very important that you get the back part of the clog, the wooden part, no further back than where you have rasped the wall down. And this is probably the most common mistake made, and that is getting it too far back. But you can always undo the screws and adjust it after you watch the horse walk. So you gently put it down, or easily put it down, and insert your screws. Now, sometimes we will just use the screws to connect the clog without wrapping it in casting material if we think that's sufficient. And we'll apply 3 to 4 screws in each side. And this is how the foot should look after you get the clog applied properly. So we will put 2 screws in, watch the horse walk, and then we will apply to see if it's walking correctly like we want it. Heel landing first, not toe landing first, or we want it heel first or flat when the horse walks. So we'll watch it walk, and then we'll put the other screws in if we want to just use screws to keep it on. If we think the horse is going to be in some difficult conditions, we will put casting tape around these screws to hold it on more securely. Stop. Put a wooden block underneath the foot just to raise it off of the ground so we can apply the cast. We're going to soak the cast material, and this is EquiCast hoof cast material for this purpose. We'll soak it for approximately 10 seconds. Then we apply the cast material onto the screws and the hoof wall. We're careful not to get the cast material up on the bulbs, because that will cause problems after it cures. So we're going to go around several times encompassing the screws and the bottom of our clog. Then we're going to wrap this while it cures with a boxing wrap, package wrap material. Vet wrap can be used also. And you need to, I didn't mention it, but you do need to use gloves, because this material will stick to your hands and to your blue jeans or anything else and will never come off. So we're going to let that cure. It's going to take about 5 to 10 minutes. Here we see the completed casting over the screws, and you can see the protruding screws here. Now, in those cases where you don't want screws in the foot at all, you can, when you put the cast material on, you can leave these screws out about 1/4 of an inch, and this cast material will just separate over the screws, and then after it hardens, you can remove the screws if you want to do that. This is what the completed casting should look like over the modified clog. So this is the completion of the how-to showing application of the Hicks modified clog placed on the foot in laminitic cases. If you have any questions, you may call me. Our clinic phone is 903-549-3451. If you have any questions, comments, etc. Thank you.